Hello, my name is Clionagh McElhinney. I am the Acute Liaison nurse in McElhinney Hospital. So why have a liaison nurse for people with a learning disability? People with a learning disability are living longer, and young people with complex disabilities are surviving into adulthood. It is well proven that people with a learning disability have greater health needs than the general population, therefore will come in contact with the general hospitals more often. This has been highlighted in a number of reports and publications. Locally, we had the GAIN guidelines here in 2010 in Northern Ireland, and they were reviewed again in 2014 and 2018. That was the care of people with a learning disability in a general hospital setting. Within the GAIN guidelines, the three recommendations they recommended were the hospital passport. They needed a regional hospital passport for people with a learning disability. They needed more training awareness around learning disability in general hospital settings, and to consider the appointment of an acute liaison nurse. And to date, I am the only liaison nurse in Northern Ireland, so the Western Trust is leading the way and championing the way for this. Other reports, such as the confidential inquiry into the premature deaths of people with a learning disability, show that diagnostic overshadowing is very common and it's a real concern. More recently, there is reports, and the NHS England have the Learning Disability Mortality Review Programme. It started in 2018 and continues to look into premature deaths of people with a learning disability, the cause and causes of their death. And we just had a launch with MenCap in 2019 and the Treat Me Well campaign, and that is currently ongoing, where they again are highlighting the needs of people with a learning disability, their healthcare needs throughout a general hospital setting. So these reports have recognised areas of good practice, and there was a commitment from staff in developing and improving services for people with a learning disability through excellent initiatives and service user involvement. However, they also highlighted poor experiences and health outcomes for people with a learning disability, including premature and avoidable deaths of people with a learning disability in general hospitals. They highlighted facts such as people with a learning disability have poorer health outcomes than the general population. Women with a learning disability are dying 17 years younger than those without, and for men it is 14 years younger. People with a learning disability are more likely to access healthcare services than those without. People with a learning disability are five times more likely to come into the general hospitals. Diagnostic overshadowing is common. It is usually put down to, it's their learning disability, as opposed to looking beyond that. 1 in 200 people with a learning disability die each year avoidably. People with a learning disability are twice as likely to suffer from diabetes, heart failure, chronic kidney disease or stroke. So, as I said, this is one of the main reasons that they looked into employing liaison nurses. We in the Western Trust are leading the way regarding this appointment. So, by having a learning disability nurse in general hospitals, it is intended that by working collaboratively with all acute care staff, we will enhance and encourage safe and effective care for people with a learning disability by providing specialist support, advice and assessment, and linking in with colleagues. Training and education and support, developing existing care pathways and creating new ones, and raising the profile of learning disability and complex needs within the acute hospital setting. Also, As a liaison nurse, one of my main roles is supporting with reasonable adjustments. One of the main reasonable adjustments is the regional hospital passport, which I would hope that everybody by now should know that there is a regional hospital passport for people with a learning disability that was launched in 2017. Very similar to the previous document on dementia care. It's about knowing the person's individual needs and making reasonable adjustments before examining them. So my journey so far, since commencing post in August 2019, I've had 80 referrals. The main source of referrals have been from community learning disability staff, such as social workers and community nurse. Unfortunately, there has only been 7 referrals received from acute sector staff. This shows me that there needs to be more awareness of my role and promotion of my role within acute sector staff. The majority of learning disability patients that I've seen over the 7-month period have been in medical wards, A&E and outpatient department, and this would be in keeping with key research that shows that people with a learning disability are more likely to have health conditions such as aspirate pneumonias, neurological conditions, and attend outpatient departments. Within these referrals, my activity has been assisting with discharge planning, providing behavioural advice and risk assessments, communicating and liaising between acute and community services, providing training, education, and being recently involved in the induction programmes of Band 5 nurses coming onto the Western Trust to highlight the important role of the acute liaison nurse in providing safe and effective care. I've also been involved in the promotion of the hospital passport. In 2017, as I said, it had been launched, but at that time it was very much to the forefront. Since I've been in post, that unfortunately has not been the case. So I'm in the process of trying to get the hospital passport up and running and be very, very present within the acute sector setting. As alluded to before, reasonable adjustments. I've been very much involved in easy read materials, adjusting appointment times, assessing with the appropriateness of the environment for the individual to be examined in, and I've also been involved in pre-admission planning, which is essential when a person with a learning disability is coming into acute setting. Networking is an essential part of my role, and as I am currently the only learning disability liaison nurse in Northern Ireland, I've had to go and source further afield, and I am in regular contact with other learning disability liaison nurses in England who have been established for the past 10 years. I am currently in the process of joining their National Learning Disability Nurses Network, and I hope to achieve excellent support and gain a great source of knowledge in developing protocols, guidelines and care pathways for people with a learning disability in an acute setting. So my outcomes so far have been, there have been many positive outcomes since taking up this post. I suppose the most positive one for me is the improved positive experience of the patient with a learning disability. Through making reasonable adjustments, I have promoted the patient to be more relaxed, cooperative with clinical procedures and investigations, and have alleviated anxieties around coming into an acute general setting. I've also been able to assist with timely and internal transfers by liaising closely with my colleagues in the community learning disability teams and improving communication between these services. On one occasion, I prevented an admission from A&E onto a ward, as I was able to assist with information between a consultant in A&E and a learning disability consultant. the patient was able to have the necessary procedures carried out in a timely manner within A&E department rather than being admitted. This resulted in the patient being discharged from A&E within 4 hours, resulting in less distress to the patient and the family, and by making best use of the resources, including bed management and cost effectiveness. So, to put my role into context, I am now going to give you a case study. Obviously, the name has been changed to protect the identity of this patient. So, Peter is an 18-year-old who has a diagnosis of learning disability and autism. He has limited verbal communication. He usually communicates using physical prompts and gestures. He is auditory sensitive and has difficulty with transitions. Peter is very ritualistic and does not like unfamiliar environments or disturbance to his daily routine. Peter was having intermittent rashes around his face and neck area. He would often complain of pain in his fingers and knees by pointing to these areas. This behaviour had become unsettled and he would cry more often. His parents attributed this to Peter being in pain. His GP referred him to rheumatology for further investigations. Peter has been reluctant to engage and cooperate with medical examinations, and hospital environments cause Peter great distress and anxiety. So following a referral from Peter's social worker, I carried out a home visit to meet Peter and his parents. A hospital passport was completed. Triggers for Peter's behaviour was identified, and these were mainly babies crying, children screaming, noisiness, or unfamiliar environments. Peter's hospital passport was subsequently discussed and his outpatient journey reviewed with the ward sister, and reasonable adjustments were put into place for Peter's appointment. So the reasonable adjustments that were put into place was Peter's appointment time was changed to first appointment of the day, so that Peter would not have to wait, and the outpatient department would be quiet with minimal people in the area. The entrance of the outpatients, Peter coming into the outpatients department, was also changed to reduce movement around the hospital so that he could transition more easily. Staff at the outpatients department had read the hospital passport prior to Peter's appointment, so they were familiar with his individual needs. Although these reasonable adjustments are quite simple, but they are very effective and resulted in a positive experience. The outcome of this appointment was that Peter was relaxed and therefore cooperated with the clinical procedures throughout the appointment. He displayed no behavioural issues while he was in the department or anxiety, and his parents were able to have a very productive consultation with the doctor and provided a detailed history of Peter's symptoms without being distracted by Peter's behaviours. So, as this is a celebration of nurses, of course all jobs do have its challenges, and as the post is in its infancy, there is many challenges that I face on a day-to-day basis, and the interface between learning disability nursing and the acute sector. However, I'm going to end on a positive note and just give you some feedback regarding my role. Hopefully this presentation has been informative, and I have provided you all with an insight into my role as acute liaison nurse for people with a learning disability within Altnagelvin. So here, this was feedback from a service user following an outpatient's appointment. So they found me to be helpful and supportive throughout the whole experience. The patient coped so much better with the special arrangements, which were the reasonable adjustments. They have said that they hope her role, which is my role, and service will be here for a long time, and I hope that there will be more learning disability liaison nurses within Northern Ireland. This was feedback from a learning disability social worker who had received an email from a parent, and they said, They wanted to pass on their gratitude for all the help and support that I had provided. The help that I provided with today was first class, and nothing was a problem. The service she provided today was invaluable to our families. She liaised with a variety of consultants, and she was instrumental in assisting the family to navigate services. Thank you for listening.